What's up, guys? Welcome back. Jeremy the Machine Scott here. Today we've got a very special episode, and one of the things I've been meaning to make a video about this. I have a lot of people that I know and people that I've spoken with have been dealing with this specific issue, and I have a lot of information on it, but sometimes I don't have enough time to sit there and explain it. So I think it's going to be great if you do have an issue with this, or you know somebody that might need help with this, if you can send them this video so they can sit down and listen to it. So what we're going to talk about today is diabetes. Okay, so a lot of people have type 2 diabetes, and or a lot of people have pre-diabetes, which can lead to type 2 diabetes. But first we're going to talk about diabetes. Okay, so we're going to talk about what is diabetes. Okay, so let's first discuss what diabetes is. Okay, there's a few different types of diabetes. There's type 1, which is pretty much not reversible, and there's type 2, and then there's gestational diabetes, which we're not going to get into that today. Gestational diabetes is basically when you're pregnant and you have diabetes from being pregnant. So we'll touch on that on another video to help out some of the ladies who might be struggling with gestational diabetes. We can talk about some solutions for that as well to help you out on that as well. So if this is something that you feel is helping you out, and if it's some useful information to you, before we begin, make sure you subscribe and hit that like button down below. So diabetes is when your blood glucose, also known as your blood sugar levels, are too high. Okay, so we don't want to have our blood sugar levels up too high. So our blood glucose is your main source of energy. When you eat food, in certain foods and carbohydrates, it gets broken down into blood glucose and gets used for energy. Okay, now let's talk about the hormone called insulin. Okay, insulin is a hormone that your body produces. Okay, and it is made by the pancreas. Your pancreas creates insulin. And what does insulin do? Okay, when it's created by the pancreas, why does it happen? Why does it get created by the pancreas? What are the functions? Okay, it takes the glucose from the food that you eat, okay, and it carries it to the cells. So pancreas creates insulin. Insulin takes the glucose from the food that we ate. So the glucose is floating around in the blood. The glucose gets carried into the cells to be used for energy. Okay, that's what the insulin does. So when the glucose stays in the blood, okay, this is something that we don't want. Not good. Okay, when the glucose stays in the blood, that's what people mean when they say, I have high blood sugar, or my blood sugar levels are high. Or if you know somebody who's had diabetes, my blood sugar levels are too high right now. So that's why they take insulin. They take artificial insulin because their body's not creating insulin. That artificial insulin takes the glucose and it takes it to the cell to be used. Remember that. So it's not good to have a lot of glucose floating around in the blood. Okay? It doesn't reach the cells because your pancreas is not doing what it's supposed to do. Okay? It needs to produce that insulin, and it needs to get carried to the cell to be used for energy. Okay? That's why, you see somebody, or you hear about somebody who's diabetic, and they can go into diabetic shock, and they pass out and go into a coma because all that glucose is just floating around in the blood and is not being used for energy. You need to have that energy, okay? Which is that energy is brought to us by insulin. So let's Let's talk about the two different diabetes that we're going to focus on today. Two different diabetes is type 1 diabetes and type 2. Okay, type 1, okay, your body is basically producing no insulin. Your body's not able to produce any insulin. You have to take artificial insulin. So your immune system attacks and destroys the cells when you have type 1, okay? So you have to take insulin every day to stay alive if you have type 1 diabetes. So type 1 is very severe and it's very dangerous. If you don't take your insulin, you will die. Okay, you see the little skull? That's type 1 diabetes. It's something that some people unfortunately have to live with. Okay? Now, let's talk about type 2. This is more common. This is why we're going to discuss type 2 diabetes a little bit more and focus on that, because the type 2 diabetes is a little bit more common. 1 in 4 people over the age of 65 years old have type 2 diabetes. That's pretty common, okay? So there's some things that you can do to prevent type 2 diabetes, or to make sure that you don't have it, or to keep yourself regular if you're pre-diabetes, or if you have type 2 diabetes, how to fight against that. You gotta fight against it. So there's a few things that can impact type 2 diabetes. Genetics. So if you have a family history of type 2 diabetes, if it runs in your family, then you probably wanna be on a good exercise program. You probably wanna make sure that you're eating good and eating clean, not eating sugary foods and foods that are packed with saturated fats and high sodium foods. Basically eating a lot of processed foods. You want to make sure that you stay away from those foods, and you want to make sure that you are on a good exercise program. Okay, so genetics. Pay attention to the family history. Think about, have a lot of people in your family had type 2 diabetes? So you want to pay attention to that and watch that, because if you have a lot of bad habits, drinking soda, drinking a lot of alcohol, drinking sugary drinks, eating processed carbs, just eating bad, not having a clean diet, not being disciplined, then you're more than likely going to end up getting type 2 diabetes, okay? And we're going to get into what can happen if you let type 2 diabetes kind of run your life and take over. There's major consequences. So you got to do the things that you need to do now, like have self-discipline, eat the right foods, meal prep, exercise, work on your fitness, okay? Because if not, then there's major consequences for that. So you don't want to deal with that. I know meal prepping, eating healthy, going to the gym, getting good rest, all these healthy habits sometimes seem like a pain in the butt, but I think what's more than a pain in the butt is dealing with diabetes and dealing with the consequences of having diabetes, which we're going to get into in just a moment here. So if you're overweight, okay, that can also cause you to have type 2 diabetes. If your body fat's too high, there's a direct correlation between excess belly fat and type 2 diabetes. So if you have excess belly fat, why do you have excess belly fat? Because you're eating bad foods. You're eating a lot of foods that are high on the glycemic index, sugary foods, processed foods, foods that are high in saturated fats. So you have belly fat, and so you also have type 2 diabetes, or if not, then you're probably going in that direction. So if not, it's time to make a change and start working on some self-discipline and start correcting your eating habits and get on a good workout program. Okay? If you need help getting on a workout program, please visit www.quickfit1.com for either in-person training or online coaching as well. I create awesome workout programs for people as well, with cardio, resistance training, meal plans, bi-weekly check-ins. So there's one solution, is get connected with www.quickfit1.com. Okay? So belly fat is very close. Belly fat has a very close connection with insulin resistance. If your body is resisting against insulin, then it's very common with overweight people. Bad diet, it's all connected. Bad diet, lack of working out, belly fat, high body fat, obesity, insulin resistance. If your body is resisting that insulin, then the insulin is not able to do what it needs to do. What does the insulin do? It carries the glucose to the cell to be used for energy and burned up, okay? So we need that insulin, okay? Your body, when your body releases that insulin, that's what it's being used for, to carry that glucose to the cell. So if it's not, if your body's resisting that hormone, then obviously we're putting ourselves at risk for type 2 diabetes. So eating bad does not help. Eating bad is going to create that insulin resistance. A bad diet, not exercising. That glucose is floating around in the blood system. If you exercise, then you're going to end up burning up some of that glucose. It's going to help you to keep your blood sugar levels down lower. So eat right and lose weight. That's all. That's how we fight against type 2 diabetes. Eat clean and lose weight. Stay at a healthy body fat percentage. How do you eat clean? Pick good sources of protein, okay? Healthy fish, tilapia, salmon, okay? Lean protein chicken, egg whites in the morning with a good slow burning carb, old-fashioned oats, steel-cut oats, baked sweet potatoes, whole grain brown rice. Stick to whole wheat pasta, chickpea pasta. So you want to eat beans, healthy fats, almonds, cashews, maybe some almond butter. So these are the things that you want to be incorporating into your diet. Dark leafy green vegetables, spinach, broccoli, asparagus. So it's very, very important to have a well-rounded diet. Make sure you're eating a good source of protein, carbs, and fat. Strawberries, blackberries, blueberries, raspberries, these are all low on the glycemic index. These are the best sources of carbs for you to be eating if you want to fight against type 2 diabetes. So it's time to clean up the diet. Start incorporating healthy eating habits, okay? If you have high blood glucose, which once again is, if you have high blood glucose, that's because the pancreas is not working right and it's not secreting insulin, and that glucose is not being transported into the cell to be used for energy. So therefore you have high blood glucose. High blood glucose, okay, can cause heart disease, stroke, kidney disease, eye problems with your vision. Okay, these are all horrible, horrible things to be dealing with. Nobody wants to live life dealing with these things. So take your health seriously. Take your diet seriously. Take your workout plan seriously. Have self-discipline. Deal with the pain of waking up at 5 a.m. tired, you don't want to do your cardio, going for your run, or deal with the pain later of dealing with the side effects they're going to get and the consequences from having high blood glucose. Would you rather deal with these? These are all seem very painful. I'd rather deal with the pain of waking up at 5 a.m., doing my cardio, and maybe eating some oatmeal because I don't feel like eating oatmeal because I'd rather eat donuts and pancakes with syrup. So I'd rather deal with the pain of maybe making some sacrifices with my diet, making some lifestyle changes. I'd rather deal with that pain than deal with this pain. Choose your pain. Choose your hard. Yes, it's hard to eat oatmeal and baked sweet potatoes when you'd rather be eating French fries and potato chips and muffins in the morning. Yes, it's hard. Choose your hard, okay? You got to choose. You got to make a choice. You have a choice. Your health is in your control. Your health is in your hands, okay? Make a choice. Make a choice today. Kidney disease, eye problems, dental disease, nerve damage, foot problems, lose limbs. So this is very serious. Ladies and gentlemen, you can actually lose limbs if you are suffering from diabetes, or even if you have pre-diabetes. That's a warning sign right there. It's time to make a change. It's not too late. You can turn it around. Make a change now, okay? And if you have any more questions or if you have any comments, leave your questions in the comments section down below. I'll be more than happy to answer your questions. Make sure you subscribe and hit that like button down below, especially if this video was helpful to you. If you liked it, please remember to like, comment, share, and subscribe, okay? Jeremy the Machine Scott, thanks for watching. I'm out.